Okay, hi, good evening, everyone. I'll get started as we have some other participants joining us. So I'd like to welcome you to this evening's webinar on mental health during COVID-19 for healthcare professionals, and like to thank you for taking the time to participate in this webinar. It's certainly a very busy time. My name is Catherine Sisak, and I'm a clinical manager with Disability Prevention Services. I have been with Homewood Health since 2016, first as a trauma therapy specialist, where I was working with clients one-on-one in individual psychotherapy and also group psychotherapy. And now I oversee our national trauma care program where we have over 200 clinicians and about 600 clients, and our national depression care program where we've got 400 clinicians and close to 4,000 clients. So again, thank you for taking the time to participate. It's truly my privilege to be with you all this evening and to have this time together. My hope is that the information that's provided will be supportive and helpful to you, perhaps to those who you work with, to your loved ones. And I will note there's a lot of information that I'll be covering this evening. So I would encourage you to just sit back, consider how the information provided resonates with you, what's meaningful for you. And following today's webinar, shortly after today, you will be provided with a link where there will be an audio recording of this training for your reference. So you'll be able to listen to it again if that's something that's helpful to you. We are a fairly large group this evening. I can see that we've got about over 50 people on, which is excellent. So if you have any questions as I go through the material, feel free to use the chat feature and I'll do my best to answer them as we go through the webinar. And then I'll make sure that we've got some time at the end for some Q&A as well. So Homewood Health, we are Canada's leader in mental health and addiction services. And we provide a continuum of stay at work, return to work, and treatment services. We have a team of over 4,500 staff and clinical professionals. And our complete suite of services includes organizational wellness, employee and family assistance, programs, assessments, outpatient and inpatient treatment, recovery management, return to work services, as well as family support services. And these are all customized to meet the unique needs of individuals and organizations. So for more information about our services, you can go onto our website, homewoodhealth.com. Okay, so in terms of what we'll be covering this evening together, looking at COVID-19 and what are the psychological impacts of healthcare professionals who are really working at the front lines of this global pandemic. What's the impact on those individuals, looking at experiences related to trauma, moral injury, compassion fatigue, and burnout, looking at what are signs and symptoms of psychological distress, and then really trying to focus our time this evening on what are some mental health strategies. So what are some practical things, strategies, skills that you can use, that your colleagues, that your loved ones can use to cope during this time, and then finally ending with some resources. And so our goal this evening is really twofold. The first one is to increase awareness. So increase awareness about what are the psychological impacts of trauma and COVID-19, and just increasing awareness about what might be some of the signs and symptoms in yourself and those around you that you might be struggling, or it might be a good time to reach out for support. And then learning together some strategies to reduce psychological distress and increase well-being during this time of the global pandemic, but also things that you can use beyond. And so just starting with some statistics. We know already that from the 2003 SARS outbreak, as well as early reports related to COVID-19, that healthcare workers experience considerable anxiety, stress, and fear. And a survey of 1,257 nurses and physicians, now this was in China, who were caring for patients with COVID-19, it was found that 41.5% of respondents had significantly more depression, anxiety, insomnia, and distress than providers who did not care directly for patients with COVID-19. And related to that, healthcare providers may be particularly vulnerable to the negative mental health impacts of COVID-19, and this is in part due to their greater risk of exposure to the virus, concerns about infecting your loved ones, more intense work conditions, shortages of PPE, and so forth. And so while there are people who are fortunate enough to be able to work from home, or who are able to reduce contact with public or socially distance and still be able to do their job, these are not the types of accommodations that are typically possible for healthcare professionals. And so all of those factors really do impact mental health as well. And we know that those who provide direct care to patients with COVID-19 and then unfortunately have a friend or a family member who goes on to become infected, or those who've been quarantined may be 2 to 3 times more likely to develop symptoms of post-traumatic stress than those who have not been exposed to these conditions. And finally, I think a statistic that's really important is that when they did look at studies at mental health of healthcare workers post-SARS, what was shown is that symptoms of post-traumatic stress and other mental illness persisted for up to 3 years after the end of SARS. And so I think that's just such a strong message about how important and really critical it is that we support healthcare professionals who are at the front line of this pandemic, support with mental health strategies, coping strategies, and that we can expect that the impact of working frontline of the pandemic can persist for 3 years based on what we know from SARS. So very, very timely that we're looking at this. And so, as I said, we'll look at trauma, moral injury, compassion, fatigue, and burnout. And really these are concepts, experiences, psychological experiences that you may relate to, or somebody that may relate to. And so if we start with trauma, all of us experience some level of stress on a probably daily basis, right? Whether it's at work or home. So things like deadlines, juggling family needs with work needs, deadlines, traffic, all those typical stressors. And then all of us, we usually face more intense experiences as well, like personal illness in the family, could be unemployment, financial pressures, dealing with a major loss, and so forth. Even positive stressors like moving, a new vehicle, a promotion, a new family member, all of those things can cause some level of strain on us and some level of stress. But in most cases, we have the capacity to be able to cope with a range of life experiences, whether they're expected, unexpected, mild, or intense. And so that really differs from when we think about trauma. And so trauma is used to describe, it could be one event or a series of events that is experienced as physically or emotionally harmful, could be experienced as life-threatening. And the main thing here is that it overwhelms our ability to cope, right? So as a healthcare professional, we might be talking about one intervention, one patient, one situation that you've intervened, or it could also be the cumulative impact of intervening on a number of difficult situations. And it's really that experience where your ability to cope is overwhelmed. What's important to note as well when we think about trauma and the impact of trauma is it's such an individual and unique experience. So it's not necessarily the event that we would per se consider traumatic as much as how is it experienced by the individual. So if you think about yourself and some of your colleagues that you work with, you might have all intervened in a similar situation, but the impact on each of you will be different. And so when we think about trauma, it's really thinking about what's the unique experience of the healthcare professional who has intervened in a particular situation or in a number of situations. And so at work, as you look at the list here on this slide, what I would encourage you to think about is any changes that you've noticed in yourself or in your colleagues, in your loved ones, in terms of functioning at work since COVID-19, or it could be since before, right? And so some of the examples here might be that trauma, being impacted by trauma, it could look like having difficulty remembering or concentrating on tasks, having a hard time with time management, feelings of fear and anxiety about things that typically did not cause fear and anxiety, having unreasonable reactions to normal situations, having anger outbursts, or just interpersonal conflict, and so forth. So, again, just thinking about reflecting on any changes that you might observe in self or others. And these are some of the ways that trauma might show up at work, or impact of trauma. And so moving on now to moral injury. So this is a concept that was developed in military settings where soldiers who were returning from deployment that were involved in events that transgressed, went against, were in conflict with deeply held moral convictions or beliefs or values. And so that's really what the term moral injury means. And so while both military service and healthcare vocations, these are vocations that individuals may choose for altruistic reasons, for principled reasons, to help, to protect, to serve. I think the difference, and a really key difference with healthcare, is that there is an underlying assumption that it is the role of the healthcare worker to heal and to cause no harm. And so when situations arise that do not allow for healthcare workers to deliver care in the way that they have been trained, that is to help people and to do no harm, this is something that can be associated with a psychological experience that we term moral injury. Now, this exists on a continuum from moral challenge to moral injury, depending on the experience, the severity of the experience, and so forth. And really, what it is a feeling of, I have done something wrong, or I have witnessed, I have seen, or I have heard someone do something that is wrong, that goes against my own morals, values, code, or ethics. And so just some examples of situations that healthcare professionals may experience as a moral challenge or potential moral injury. It could be caught in that dilemma, that conflict of being prepared to put yourself in harm's way by working the front line of a global pandemic during a time of a lot of uncertainty. And then that natural desire to protect yourself, to protect your family, fear of the consequences for yourself, for your family, right? So I was just speaking with a nurse the other day who gave the example of, at the beginning of the pandemic, she was sleeping in a trailer in her driveway, and her partner and kids were sleeping at home. So, I mean, what an incredibly difficult situation, and to wrestle with that dilemma, to wrestle with that conflict, right? And so that's one of many examples of where moral injury, moral challenge can come up. It could be needing to quarantine when you might be needed at work, placing additional stress on your already stretched colleagues, or being asked to come in when you are ill yourself. The requirement to quarantine from family for weeks at a time, and the stress that could put on yourself and your family. Making decisions about which patients will receive certain appointments, certain resources, certain equipment, discontinuing certain procedures during the time of COVID. And also, it could even be things like self-care, right? On your days off, wanting to take care of yourself, to nourish yourself, nurture yourself, go for a walk maybe with a friend, but then that other side of it is, can I do it? What are the public health regulations? Am I putting anybody at risk? So all of these complex situations can present moral challenge or moral injury. And so examples of moral injury where you have a sense that you have witnessed or seen someone do something that goes against your code. So this might be things like, hospital or clinic rules about patients being able to have visitors or not. It might be even things like seeing people in your community hoarding food, hoarding toilet paper, paper towels, etc. Rules about discharging clients early to avoid infection, rules about minimizing human contact, human touch with patients to avoid infection. So these are all things that can raise moral injury and moral challenge. And so just one thing to note is that with the first sentence there, when we are in a position or a situation where we have done something that goes against our own code, for example, you have a patient who perhaps is palliative, and there's a rule that you cannot allow visitors and you enforce that rule. You do not allow the family to come in. You follow that rule, even though it goes against your own values of connection, support, at end of life, for example. The feelings in those types of situations might be those of guilt, shame, or embarrassment. In situations where you're witnessing, you're seeing, you're hearing a system, an institution, a colleague, it could be doing something that goes against your code, the feelings are more likely to be those of contempt, anger, or disgust. And so when we just think about the cycle of moral injury moving from left to right, there is a transgression. So say, for example, you have upheld that rule about, such and such patient is not permitted to have visitors. There's a dissonance or conflict. So the conflict is between the rule, supporting and upholding the rule of the institution, upholding public health measures, and then a conflict with your own values and morals of connection, of support, of care, of accompanying people through suffering and pain. And then a typical way of coping with this psychological conflict is what is deemed an internal attribution. And so this means that we attribute the conflict basically to ourselves. I should have been able to do something else. I should have found a way. There's something wrong with me. I'm not a good enough healthcare professional. I didn't try hard enough, etc. These types of attributions lead to shame or guilt, which can lead to withdrawal and avoidance. And then it can also lead to symptoms which are similar to post-traumatic stress, such as avoidance, intrusions, numbing, self-harming, and so forth. And so the key message here is that if you've got, you're noticing some of those feelings of shame or guilt or anxiety, is to notice that impulse to withdraw, to avoid, and to really act counter to it, to reach out for support to your peers, to your trusted family members, to your supervisor if you can, but to really act opposite to withdrawing by reaching out for connection, support, communication, so forth. And so moving now to compassion fatigue. So I think, in healthcare profession and in helping professions, really seeing compassion fatigue as an occupational hazard. And compassion fatigue is really about carrying the weight of the stories and of the situations, the critical situations that you've intervened in over a period of time in your career. It can be really, dramatic and difficult, critical situations, but compassion fatigue can also happen from being exposed to low-grade traumatic events, or just accompanying people through their pain, their suffering, their hurts over a period of time. And that's what is termed compassion fatigue. And I think what's really important to consider here is that for a lot of people who go into the healthcare profession, to helping professions, these are often people who are helpers in their personal lives and who have been in that helping, supporting role even before they've gone into their career, and who continue to hold that role in their personal lives as well as in their professional lives. And so the potential to be fatigued and to experience compassion fatigue is really there. So, it's about noticing where you are in terms of compassion fatigue. You can see the continuum here of low stress all the way up to severe stress. And so just taking a minute to look at some of these examples of how compassion fatigue might be showing up for you, where you might put yourself here as well. So compassion fatigue and burnout are two distinct but related psychological experiences or responses. And unfortunately, although they're related, there's nothing to say that they can't happen at the same time. Burnout is a little bit different from compassion fatigue in that it really relates to more kind of the tasks of the job. So it might be related to feeling a real sense of lack of control. So I mean, I've talked to healthcare professionals who, as a result of COVID, are being moved around to different units, different shifts, different patients that they've never worked with. They've specialized in a certain area. So that sense of a lack of control can be so significant. being impacted by a dysfunctional workplace environment, so dealing with a volatile and sometimes threatening public, and this has certainly come up now during the global pandemic and public and community reactions to different public health measures that are being put into place or different rules at hospitals and clinics and so forth. Lack of support and isolation, and then also a work-life imbalance. And so certainly when we think about the implications of COVID-19, depending on, where you are, how this has impacted your work-life balance, if you've got children at home that you're homeschooling, or if you've got restrictions at daycare, or if you've got aging parents that you're not able to visit and care for the way that you typically do. These are just huge factors that can really contribute to burnout as well. Right. And so when we think about having a trauma-informed shift, it's thinking about, instead of what is wrong with me, to what has happened to me, right? And what am I experiencing? What has happened to me at work? What has happened to me in my personal life? How am I responding? How am I doing? Some of the symptoms of burnout you can see here may include apathy, feelings of hopelessness, disillusionment, exhaustion, and so forth. And I'll let you read through this list and you can consider and reflect about where you might see yourself here. So again, it's about increasing awareness and just pausing and reflecting, kind of doing a check-in with yourself, taking stock, taking inventory about where you might see yourself with some of these psychological experiences. So I'll shift now to looking at what are some mental health strategies. We know that with COVID-19, it's a very difficult time. It's a very unique and particularly difficult time for healthcare professionals working at the front lines of the pandemic. So looking at what are some practical strategies and skills that can support during this time and beyond. So some of the strategies that we'll look at are how to tolerate uncertainty and distress, looking at skills related to self-regulation and radical acceptance, mindfulness, self-compassion, and then really making it a priority to maintain social connections. And so one of the main skills or mindset shifts during this time is to focus on what you can control. And so, uncertainty is very uncomfortable. It's really natural for us to try and force things to be more certain, but it's really an exhausting and energy wasting process. And so, we can't control if our neighbors are hoarding toilet paper. We can't control how other people are managing and respecting public health measures. But we can control our attitude, our who we spend time with, whether they give us energy or they deplete us of our energy, our own social distancing, finding meaningful activities to do, meaningful ways to spend our time. So really looking at what we can control. I do think that this mindset of focusing on what we can control is particularly a difficult shift potentially for healthcare professionals. And, in healthcare, being in control, managing critical situations and variables is so critical to the life-saving work that's being done. And so shifting to really focusing on, okay, what can I control now in terms of my own life and how I'm impacted, my family life, it can be a difficult shift. But I think it's really about starting small and identifying for yourself what's within my control and how can I nurture those aspects, right? So it might include strategies like avoiding advice, setting healthy limits, setting healthy boundaries, acknowledging differences of opinion, redirecting people to appropriate supports, and just generally focusing on those things that are in our life that we can control. So looking now at some emotion management strategies. So I think, the natural inclination is when we feel bad, we want to kind of put that feeling away or run away from it or suppress it. And so the strategy of tolerating negative emotions, it's a bit of a paradox, and it's a little bit counterintuitive. Because what we're actually talking about with this strategy is noticing when you're not noticing how you're feeling. If it's positive, good. If it's not a positive emotion or an emotion that doesn't feel good, treating it the same way, noticing, observing how you're feeling, perhaps being able to name the emotion that you're experiencing. And the reason for this is research really demonstrates that there's a robust link between emotional or experiential avoidance and anxiety and depression. So the more that I feel bad and I try and run away from feeling bad or feeling sad or whatever it might be, that this is linked actually to risk for depression and anxiety. And so the goal is actually for us to increase our tolerance to be able to sit with our emotions. So if I feel sad, if I feel anxious or overwhelmed, instead of trying to make that feeling go away by numbing myself through shopping, substances, risky behavior, with this strategy, it's really about noticing that feeling and sitting with it, trying to let it pass in due time, and self-soothing in a way that doesn't make the problem or feeling worse, right? And then there's also managing extreme emotions like anger, for example. And so in that case, what we're trying to do is rather than act on that impulse, we're trying to reduce the intensity of it. So just as an example, say for example, you've worked a double shift, you come home and you see people in your community are gathering outdoors without masks, and this may or may not respect the public health guidelines in your own community. And so, you feel like you have sacrificed so much and you feel like lashing out, right? And so the feeling or the strategy to apply in this case is to gain distance. So it's just to stop and observe what it is that you're feeling, non-judgmentally. It's not good or bad or right or wrong. It's just to observe. I'm really enraged right now. I'm really furious. I'm really raging, right? Just to notice that. To describe it by putting words to it, right? I'm enraged. I'm furious, right? I'm outraged. And an opposite action refers to acting opposite to the impulse that you have. So your impulse in that situation might be to lash out, but opposite action is really about acting opposite to that. So I had a nurse who told me she had a similar experience, and she said, you know what? She said, I'm going to go home and I'm going to nurse myself. So turning inwards, taking care of self could be an example of opposite action. So healthy thinking, we know that the way that we think impacts how we feel and what we do. So if there's anybody who is a fan of Brene Brown, she talks about the stories that we tell ourselves, or sometimes it's talked about as the tapes that play in our heads. So this strategy is really, again, about observing how we are interpreting, perceiving, and explaining situations to ourselves, and treating our thoughts as data, as information, but not as facts. There's a number of thinking traps or cognitive distortions that are listed there, right? From all or nothing thinking all the way down to overgeneralization. These are all common cognitive distortions. We all use them. You may use some more than others. Just as an example, so all or nothing, with my neighbor example there, it might be the neighbors should not be getting together, period, right? So it's kind of all or nothing, black or white. Jumping to conclusions might be the neighbors are behaving in an entitled way and as though social distancing guidelines do not apply to them. Catastrophizing could be things will never get better. The neighbors getting together sends a message to other neighbors that it's okay to get together and things will never get better. Okay, so just noticing how we talk to ourselves. Radical acceptance is a skill that I try and practice. It's about the radical part of radical acceptance is about accepting the impact that a situation has on us from its root, right? Radical meaning root. And so rather than struggling against a situation or fighting against it, kind of like we would sink in quicksand, radical acceptance is really about accepting the impact of a situation, the difficulty of it, from its roots. If this is a strategy that you're interested in, I would encourage you to Google it. There's a fair bit that's been written about it that's linked to mindfulness, and there's some really good strategies that you can use with this skill. And so continuing with healthy thinking, it's really about creating distance from our thoughts. Visualization is an excellent strategy. So if you find yourself ruminating, going down a rabbit hole, it's to picture that stop sign, like, okay, stop, right? Just stop. Kind of hit the stop, the pause button to slow your mind down and to be able to observe and describe your thoughts. Okay, so what am I saying to myself about this situation? If you're a visual person, writing it out can be extremely helpful. Being a scientist or detective, so again, treating your thoughts as data, as information, but not as fact, right? Not as gospel truth. So what's the evidence that I have that supports this thought or that supports this way of seeing the situation? Is there any evidence that does not support this thought, this perception, this interpretation? Is there a more healthy or balanced way of me seeing the situation? Okay. Practicing mindfulness and gratitude. So mindfulness is really about paying attention in a particular way. It includes our whole selves. And so mindfulness might be just sitting down, taking some in breaths and some out breaths, noticing your chest rising and falling, noticing how your body feels, doing a scan from head to toe. Do I have any aches or pains? Do I have any, physical stress that I'm feeling in my body? And non-judgment is a key part here. So just paying attention non-judgmentally. Gratitude, so expressing gratitude to those around us. It could be the very small but significant experience of sending a text. Thanks for doing this for me. I appreciate you. You matter. These are things that not only make the other person feel good, but research demonstrates that expressing gratitude, doing for others, impacts the person who's actually taking that action just as much and is just as beneficial. And so some daily mindfulness and gratitude practices. So again, with mindful breathing, very simple, but very difficult at times and also powerful. So simply to identify your in-breath as your in-breath and your out-breath as your out-breath, right? With mindfulness, it's not necessarily about us staying in the present moment perfectly for 5 minutes or 10 minutes, but it's about noticing when are we not in the present moment. I'm trying to focus on my in-breath and out-breath, and oh, there goes my mind thinking about work or supper or this or that. Noticing when I've gone away, my mind's gone away, and bringing it back and bringing it back and bringing it back. Concentration, so related to that, noticing where your thoughts are and really concentrating on your in-breath and your out-breath, allowing your mind to stay there. Releasing tension, so progressive muscle relaxation, PMR, is an excellent and effective strategy. I would encourage you to look on YouTube or Google for various PMR-led exercises. Basically tensing and releasing your muscles in a sequence throughout the body, accompanied by breathing, is a very effective strategy. Reflecting on what went well today, what's one small but significant thing that, hey, you know what, that actually went well, right? That conversation that I had at work, that exchange that I had with a patient, with a colleague, with my spouse, with my parent, that actually went well. And then sending an appreciative note, as we discussed. Self-compassion, another extremely effective mental health strategy. And the research is clear that self-compassion is very strongly related to mental well-being. So it actually increases our motivation by activating our mammalian care system, or increased oxytocin opiates rather than our fight, flight, stress response. So Kristen Neff, if you're interested in self-compassion, NEFF, has an excellent website with lots of exercises. I do them myself. Some of them are really like 4 or 5 minutes long, practicing self-compassion. And she really talks about how there's always one person that we can count on to demonstrate compassion to us, and that one person that we can always count on is ourselves. So again, another really important skill. And the components of self-compassion are about self-kindness versus judgment, right? So being kind to self versus judging myself for having a difficult time, for struggling, for being overwhelmed, for having compassion fatigue, right? Just being kind to self. Focusing on common humanity versus isolation, right? So common humanity, most people in my situation would find this difficult, right? And then mindfulness versus over-identification. So not necessarily over-identifying, over-attaching to our struggling, to our struggle, to our pain, but being mindful of it and noticing any struggles, any pain that we're having, allowing ourselves to have those experiences without becoming overly attached to them. Maintaining social connections. So, during a time of COVID where we're isolating and distancing and doing it, a lot of things virtually, thinking outside the box, right? So I've heard some really interesting ideas around book clubs and different kind of, support, kind of impromptu support groups between friends coming up on Zoom and Microsoft Teams and so forth. People doing game nights online, people doing socially distanced walks, people dropping off things on each other's porches, right? So kind of these ways that we can maintain connection during a time where it can feel quite isolating. Other research supported strategies, including the regulation of routines. So again, really important. These can be very simple routines. For example, every night I'm going to make sure I know what we're having for breakfast, or I'm going to set it out. Or every Friday night, I'm going to make sure we know what we're having for supper on the weekend. Or at the end of the week, I'm always going to end my week with, a certain walk and in a certain area. But these routines and rituals, that's one of those things we talked about, focusing what's within our control. So during a time of a lot of uncertainty and anxiety and stress, routine and ritual is very calming because it has the potential to create some predictability in our lives. So thinking about what are rituals and routines, if you're a spiritual person, prayer, or your faith practice, your spiritual practice, if you exercise, how you can integrate these important things into routine and ritual, very, very effective. Physical activity, sleep, and healthy eating, right? As much as possible during this time. There's a number of self-care tips listed. This is really going to be unique. It's an individual sort of preference. If you're very extroverted, your self-care might look very different than if you're an introverted person. Self-care might be a bubble bath, or it might be working on something in the garage. Self-care might also be paying your bills, making your own doctor's appointments, doing your own taxes if you're behind on them, taking care of self, right? These are the things that are really, really important as well, and make a big impact in terms of our overall well-being and mental health. Supporting yourself. So, thinking about healthcare professionals who are taking their patients' vitals all day long, taking your own vitals, checking in with yourself during the day. How am I doing physically, mentally, emotionally, socially, spiritually? So just thinking about putting that into practice, checking your own vitals during the day. What am I okay? Where am I okay? Where am I not okay? How can I get some support if I need it? Okay. Just draw your attention here to Wellness Together, which is a initiative across Canada. Homewood Health is a proud lead partner in this initiative, offering mental health and substance use support to all Canadians. To access, you can go on wellnesstogether.ca or call 1-866-585-0445 for more information about how these services can be accessed. And so I will pause there for now, and I'll wait to see if there's any questions that pop up. I know there was a question that came in at the beginning of the webinar, wondering about a certificate of attendance. So we will not be providing a certificate of attendance. There will be a link provided which will include it'll be a link for an audio recording of this training. And so that will include the date and the time and the presentation name. Yeah. Okay. So I'll just wait a couple more minutes to see if there's any other questions that come through. So there was a question about if I could share the self-compassion videos. So the self-compassion, the name that I mentioned is Kristen Neff, Neff. And if you Google her, her website will come up. I think her website is selfcompassion.org, but have a look. Kristen Neff, Neff, and you will find lots of different resources and guided activities and practices that you can do. Very effective. Yeah. Does the audio recording include the PowerPoint? It doesn't, no. The audio recording will be just that, an audio recording. The PowerPoint is proprietary, and so it's not something that is shared. Okay. Will the link contain your slideshow? Can I share it with my work? So as I said, it won't contain the slideshow, but it will contain the audio recording. So certainly you can share the audio recording, absolutely. Yep. Okay, thank you. Good. Okay, so unless there's any other questions that come through, I would like to thank you all for taking the time to participate. We were a group of just over 70 this evening, so thank you for taking the time to come and participate in the webinar. I know this is a very busy time, and would also like to take the time to thank each of you for the work that you're doing, working front lines or working in what your role is during the time of the global pandemic. It is not difficult. We're hearing lots of very complex dilemmas, situations, really not an easy time. So thank you for all that you do. And I just noticed two other questions come through, so I'll take the time for anybody that wants to stay on to answer these questions. So there's one question that came in asking about are there trends in how healthcare workers are challenged by mental health? So for example, that some professionals might be impacted or turn to substance use. So yeah, absolutely. I mean, substance use is one sort of trend. Certainly sleep is a significant issue as well. Issues with mood. I think also that difficulty, that challenge of how to set that boundary and leave work at home. So yeah, those are definitely some of the trends. And so I think it's about what we talked about this evening, noticing how you might be impacted, how those around you might be impacted, and reaching out for support, right? I think there's such a stigma still around reaching out for support, particularly if you're in a helping field or if you're in a healthcare professional role, but really taking the opportunity to seek out confidential private services. There's lots of services out there where clinicians are accustomed to working with other people who are in a helping professional role, and the unique concerns that come up. So really sort of paying attention to how you might be impacted and reaching out for support. Yeah. Okay. There was a question in about tips for falling back asleep. So yeah, sleep is so difficult. It can be, in particular, if you're a person who's working shifts as a healthcare professional, can add to that challenge as well. So, and this particular question was not about falling asleep, but waking up during the night and then how to get yourself to fall back asleep. So really, really good question. I think some of the strategies that we talked about, progressive muscle relaxation is one that I would really point you to, because with progressive muscle relaxation, it's physical because you're tensing your different muscle groups and releasing them, as well as the breath and as well as calming the mind. So that's one that's often suggested for difficulty with sleep. So that's one that I might point you to. And the other thing I might suggest is to look up sleep hygiene. So this is a term that's used to really focus on what are ways that you can first kind of just evaluate your overall sleep patterns, your sleep hygiene, and then providing some skills and tips around sleep. But middle of the night, I'd be looking at progressive muscle relaxation, some of the mindful breathing that we talked about. Yeah. Okay, thank you for some of the comments that are coming through. Okay, so just a reminder that there is a session coming up tomorrow evening at 6 p.m. Pacific time, 9 p.m. Eastern time. That'll be delivered by myself. There's also a French presentation coming up on February the 2nd. So another opportunity to attend. And then the last question here is, what are some ways to help with feeling, not supported from hospital higher ups? And yeah, some of those kind of interpersonal and staff and systems kind of issues that come up. Really, really good question, and it can be really difficult. I think the first thing to do is to start with yourself, to do what you can, what's within your control, as we talked about. So making sure that you're okay, looking at your own coping strategies, looking at any support, skills, strategies that might be helpful to you. And in terms of not feeling supported from the hospital higher ups, I think sometimes it's also about looking at who's an ally to you, who can you trust, who do you feel safe to talk to share your concerns with. Sometimes it might be, coming into a conversation, highlighting what are the issues, what are the concerns. You mentioned being safe for yourself, and then with that, maybe bringing in some options, some solutions, some potential. So, these are our concerns, and these are maybe 2 or 3 pathways forward that we see, and kind of having a conversation that way. Yeah. Okay, thank you very much for everybody's participation. Thank you for the work that you do, and I wish you all a good evening and stay safe. Bye-bye.